Welcome to this video. So in this video we are going to discuss esophagus disorders. First we need to distinguish between two main symptoms: odynophagia, which means pain while swallowing, and dysphagia, which means difficulty of swallowing. Now let's discuss odynophagia. Odynophagia means there is pain. So esophagitis, which means inflammation, because the itis means we have inflammation, usually the main symptom is odynophagia. So we should think of infectious causes. Second, pills-induced esophagitis. Third, eosinophilic esophagitis. And last, we can discuss GERD-related esophagitis. GERD is gastroesophageal reflux disease. Now let's discuss esophagitis, the causes related to infectious disease as an etiology. So first we need to think of the population. Usually these patients are immunocompromised patients and mainly HIV positive patients. So when we encounter a case of HIV with odyno, remember odyno, double O, by that I mean CD4 count less than 100, double O, we should think of the infectious causes of esophagitis. So we have Candida as a fungal cause, and usually when we think of Candida, we can have oral thrush, but this is not always the case. So if the case does not mention oral thrush, this does not rule out Candida as the cause. So in this case, we start empiric therapy. We make the diagnosis clinically. So we don't do any diagnostic workup. Instead, we give empiric fluconazole and monitor the response. If we have any response, that means it was Candida and we are treating it right. So we give fluconazole and then we treat HIV. If we don't have any response, then we need to do a scope. EGD, esophagogastroduodenoscopy. So EGD means we insert a tube within the esophagus. This will allow us to take biopsies to make a tissue diagnosis. Now, in cases of HIV with CD4 count less than 100 who did not respond to fluconazole, we have the viral causes of esophagitis. We should think of two viruses that can cause this: the cytomegalovirus and the HSV, herpes simplex virus. Let's remind ourselves, megalo means large, so the ulcerations are large, linear, and superficial in CMV. HSV, let the S help us to remember it's a small and deep ulceration. The treatment in CMV is to use ganciclovir. Megalo, large group of people, a gang of people, ganciclovir. Now for HSV, remember the S, just say S, then say clovir, S-cyclovir. Now, for the second cause of esophagitis is the pills-induced esophagitis. Now, the cause is not as a side effect of the medication, so it's not a side effect because of the mechanism of action, rather than it is a local irritation to the esophageal mucosa. So because of the pill, it's irritating the esophagus and causing ulceration and irritation and esophagitis that is causing pain to the patient while swallowing, odynophagia. So now, the way I would like to look to this topic is by remembering the disease and the medication that is related to cause this irritation. So we have osteoporosis, joint pain, acne, and hypokalemia, iron deficiency anemia. Those cases, usually the presentation will describe them. So for osteoporosis, remember oral bisphosphonate, not the IV, like residronate can cause it. Joint pain, NSAIDs, or patient have headache on NSAIDs. Acne, doxycycline can cause this. Hypokalemia, potassium chloride, and iron deficiency anemia, iron tablets can cause irritative injury to the esophagus and cause odynophagia. So this is mainly the pills-induced esophagitis. Diagnosis is made clinically and the treatment is supportive. Educate the patient on the right way about how to take the medication and stop the medication for a few days. Now, eosinophilic esophagitis. This disorder, imagine as the patient has asthma but in his esophagus. So usually they have a history of asthma, atopy, and allergy. And also in this disorder, we are going to find food impaction as a symptoms, and dysphagia, and the symptoms are intermittent, like asthma, episodic symptoms. Now, for the diagnosis, we need a tissue diagnosis, so we need a biopsy because the etiology is infiltrates of eosinophilic cells within the esophagus, causing a chronic inflammation and the symptoms. Now, for the diagnosis, the esophagus in early phases would appear normal, so EGD won't show anything. That's why they take random biopsies to see the eosinophilic infiltrates and they get a tissue biopsy. Now, in chronic cases, we're going to see concentric rings formation within the esophagus, and some would call it tracheization of the esophagus. For the treatment, avoid allergens, of course, and any food allergy that are contributing to the symptoms. The PPI trial, GERD can cause eosinophilic infiltration. So in cases of GERD, we need to rule it out first. So we give proton pump inhibitor trial first to see if any symptoms improvement. If not, then it is less likely to be GERD, and we contribute the eosinophilic infiltrates to eosinophilic esophagitis. And here we give the famous treatment, the inhaled steroids, but we take them as a swallowed inhaled steroids, mainly budesonide or fluticasone. We use also in chronic cases with concentric rings formation, we do dilatation of the esophagus. Now, for the scope in chronic phases, it shows tracheization, which we mentioned earlier, and early stages, the esophagus appears normal and they take random biopsies. Finally, I would like to discuss to review the ABCD mnemonic. So A for asthma, ATP, B for biopsy, and C for concentric rings in chronic disease, and D is the treatment. So we need diet modification and drugs, the PPI and the inhaled steroids, as taken swallowed inhaled steroids, and D dilatation.